Mr. Mark Chay.
Mr. Deputy Speaker, thank you for this opportunity to speak on this motion put forth by fellow NMPs, Dr. Tanya Swam, Dr. Shahira Abdullah, and Abdul Samad, to support healthcare beyond the COVID-19 pandemic and calls for whole-of-government effort for consistent and sustainable support. Sir, I stand in support of this motion. I would like to start by extending my heartfelt gratitude to the healthcare professionals in Singapore who have shown extraordinary dedication and selflessness in their efforts to care for patients amidst the COVID-19 pandemic. Despite the tremendous increase in demand for medical services, they have continued to provide exceptional care with professionalism and empathy. We are truly indebted to our healthcare workers and administrators for their tireless efforts throughout this challenging period. Your courage and resilience have made a tremendous impact in our fight against the pandemic, and I would like to express my deepest gratitude for your incredible work. During the COVID-19 pandemic, the Singapore government provided the healthcare workers with vital support in the form of financial assistance, resources, and training to help them manage their increasing demands while treating COVID-19 patients. The contributions of our healthcare professionals should not, however, only just be recognized during times of crisis. We should still recognize their invaluable contributions moving forward as we work towards living in a world with COVID post-COVID-19. It is easy to overlook the exceptional healthcare system in Singapore and fail to appreciate the dedication and hard work that goes into providing top-notch healthcare services across the country. The government has invested significantly in public health infrastructure and subsidized medical care, making it possible for Singaporeans to receive adequate medical attention when required, regardless of their financial background. And we should continue to uphold this, not because we want to remain competitive globally, but because it is the responsible thing to do for Singaporeans. Speaker, healthcare is a critical issue that concerns everyone because everyone needs access to healthcare at some point in their lives. Good health is essential for individuals to lead productive and fulfilling lives, and access to quality healthcare is crucial for maintaining good health. And because healthcare impacts everyone, I was happy to see this motion tabled. I fully agree with the honourable members that we should take a whole-of-government approach to healthcare. This is critical because it recognises that healthcare is not just the responsibility of the healthcare sector, but also involves many other sectors and factors. By taking a comprehensive approach, Singapore can identify and address the root causes of healthcare issues and improve health outcomes for its citizens. I want to speak on the following 4 points, which I believe should be given more attention. First, on accessibility of healthcare services for the elderly and persons with disabilities. Singapore's population is aging, and the demand for geriatric services looks to increase. As our population ages, it becomes more disposed to chronic medical conditions, cognitive impairments, falls, frailty, which can significantly impact the quality of life. This calls for specialized knowledge about the aging process and the optimal management of multiple medical conditions, medications, and physical impairments. Teaching Singaporeans how to age is something we should be invested in as well. A holistic approach is required, prioritizing not just diagnosis and treatments, but also functional ability, social interaction, and psychological well-being. For this purpose, it would be good if MOH can work with SkillsFuture to increase the access and adoption of courses which are suitable for our seniors. Such courses such as arts, nutrition, and digital literacy exist. However, I believe more can be done to provide more physical and mental well-being courses. With an increasing Singaporean population of elderly individuals, the importance of gerontology cannot be understated, as it enables our silver generation to maintain independence, improve outcomes, and live fulfilling lives. Speaker, and ensuring healthcare access for PWDs is also essential for promoting equitable and inclusive healthcare. Unfortunately, PWDs often face barriers to accessing healthcare, including physical, communication, and attitudinal barriers. I'm happy that steps have been taken to make healthcare more accessible for PWDs, such as accessible facilities like wheelchair ramps, height-adjustable examination tables, and accessible bathrooms. In addition to existing efforts, healthcare providers may improve communications for the visual and hearing impaired by ensuring that their staff is trained in sign language or providing communication aids, such as hearing aids or visual aids. In addition to physical accessibility, healthcare providers can also improve their attitudes towards PWDs by providing education and training for their staff. They can also work towards promoting disability inclusion in healthcare policies and procedures. Currently, there are many SMEs and NGOs that are in this space for enabling PWDs, and it would be good to have more dialogues on continual improvement of services for PWDs and increasing access and awareness of such services for PWDs. By taking these steps, healthcare providers can ensure that PWDs have access to the same quality of healthcare services as those without disabilities. It is essential to prioritize access and equitable healthcare to better build healthier and more inclusive society. I now move to my second point. As we celebrate the triumphs of our Team Singapore athletes in Phnom Penh, we should also recognize the hard work and sacrifice our athletes and their entourage have made to bring glory to Singapore. Our elite athletes often face intense physical and mental pressures. These pressures can affect the performance, long-term physical health, and overall well-being. To excel in their sport, athletes must maintain a rigorous training discipline, adhere to strict dietary requirements, and overcome physical injuries. Unfortunately, these pressures can often lead to mental health problems such as anxiety, depression, and eating disorders. In addition to physical pressures, many athletes face significant social pressures. They may feel pressure from teammates, coaches, fans, and the media. This can lead to additional mental health problems, including stress, burnout, and a lack of self-confidence. Elite athletes need access to resources to help them cope with these pressures. This can include mental health support, sports psychology, and mentoring from experienced athletes. It is also essential for athletes to understand that it is okay to prioritize mental health and physical health over their sport. Many athletes, such as Mei Wei and Constance Lien, have recognized this and have become advocates for mental health awareness and self-care. By acknowledging the pressures that elite athletes face and providing the necessary support, we can help them perform at their best while maintaining their long-term physical and mental health. Therefore, I hope that more support can be put into handling these unique needs of our national teams. Third, on creating a vibrant sports and fitness culture, it is true that we often take our health for granted, and until an event impacts us directly, Recently, a friend passed away from a heart attack. He was still young, and his tragic and sudden death ignited conversations amongst my peers about being healthy versus being fit, as well as our general education on health and well-being. It would be good if MOH and MOE, together with Sports SG, teach Singaporeans at a tertiary level how to exercise when Singaporeans enter the workforce. There is a difference between training and exercising. We participate in CCAs, and sports CCAs teach you how to train, push your physical boundaries for performance. But exercise is about maintenance, mobility, and lifestyle. Exercise should be a habit, and a lot to do with forming habits has to do with convenience, routine, and accessibility. Some members may know that Dr. Tanya Swam is an avid parkour practitioner. Parkour is a sport of jumping, climbing, and sliding over and through a terrain. In Singapore, this happens to be an urban terrain. And I'm happy to see that there are such projects and facilities being built in Somerset and Lakeside. I hope more urban-centric sports facilities will be built to match Singapore's landscape and interests. I hope and would like to also encourage programs to go together with these facilities. To do that, instructors need to be trained, qualified, and hired. I am happy to see that at this year's COS, MCCY announced a registration of personal trainers that cover a range of activities and disciplines. But to empower this registry, the trainers need to have updated and relevant content to teach. I would encourage Sports SG, HPB, MOE, and People's Association to have more discussions about the delivery of relevant age-appropriate physical programs that cater to a vibrant, active Singapore population. Fourth, verbal abuse towards frontliners working tirelessly to keep society functioning during the pandemic is a deplorable issue. Despite their unwavering commitment to the rigorous job demands, healthcare workers, essential workers, and other public-facing roles have been subject to verbal abuse, shaming, and criticism. In addition to it being emotionally draining, verbal abuse can lead to mental and physical health issues and impact the professional and personal lives of those affected. Therefore, it is crucial to recognize the value of our frontliners and to show support by offering gratitude, recognizing their hard work, and taking ownership of our collective responsibilities. Frontliners deserve our fullest respect, support, and empathy. Recognizing and addressing this issue is vital in holding those responsible accountable for their actions. Healthcare facilities can provide training for their staff to de-escalate tense situations and implement policies for reporting and addressing verbal abuse. In addition, public campaigns can educate people on the importance of respecting frontline workers and the consequences of their actions. In conclusion, Speaker, the COVID-19 pandemic has showcased the bravery, dedication, and selflessness of our medical workers and workforce at the forefront of fighting the virus. They have worked long hours under challenging conditions while risking their health to care for patients. As the pandemic begins to subside, the government must continue to support medical workers even after the pandemic. I would like to ask the government for healthcare workers to be provided with ongoing mental health support to deal with psychological impact of their experiences. The pandemic has taken a toll on their mental health and well-being, and they must receive the support and resources to deal with any long-term effects. Our government should also invest in health and safety measures to protect medical workers for future pandemics. It includes providing adequate personal protective equipment, training, and vaccination. Healthcare workers are at the forefront of infectious disease outbreaks, must be thoroughly protected against the potential hazard they may face in future. By showing support and appreciation for medical workers after the pandemic, we create a sense of value for their role within society. Their sacrifice and hard work deserve recognition, and this can go a long way in keeping them motivated and inspired. The government should continue to support medical workers to build a bright future for our healthcare industry and the patients that rely on them. Thank you.